shoot an x-ray, and you can then make a decision that saves quite a bit of money, and promotes value-based care, and also is better for the patient, easier for the patient, gives them more accessibility, and is also pretty cost effective.
Hey, what's up? This is Corey Dion Lewis, clinical health coach and host of the Healthy Project podcast. Now, the research shows that social determinants can have a greater impact on your health more than healthcare or lifestyle choices. The purpose of this podcast is to discuss how to improve health and reduce health inequity by speaking to healthcare professionals, thought leaders, and entrepreneurs. Now, if you're enjoying the podcast, give it a review. Or you can also make a donation to the Healthy Project using the link in the description. It takes 30 seconds and it's super easy. Hey, thank you so much for listening. Now let's get started. Hello, everybody. Thank you for listening to the Healthy Project podcast. I am your host, Corey Dion Lewis. I have a great guest with me today. I have the co-founder and CEO of RadButter Health, talking about something that just as of lately, I didn't even think about what would be a big important part of improving health disparities, and that's imaging and radiology. So, Elan, thank you so much for being on the podcast with me today. I really appreciate it.
Yeah, thank you for having me, Corey. It's an absolute pleasure, and I'm excited to share with the world what I'm working on and what's coming to everyone's fingertips soon.
Awesome, man. Well, before we get into the topic today, how about you tell the people a little bit about yourself and what gets you up in the morning?
Yeah, of course. I am a former healthcare worker. I worked for the Cleveland Clinic, Ohio Health, and I also worked in the med tech industry, working for Siemens, doing clinical consulting and sales. A little bit about me, I guess, is that I went into healthcare, working as an MRI technologist originally before becoming a supervisor, manager, and then going into the private side of things. And I think, really what I learned throughout the years, when you're in school or you decide to get into the healthcare industry, you don't really know, what you're getting yourself into or what you're going to see. And then you get a taste of it, of helping people, and you see the circumstances of different people, and you realize how much you can do for so many and affect so many people's lives in a positive way. And the thing that was really cool for me is after getting all this experience, seeing things, I realized, I could have a much bigger effect. It's awesome to be able to affect people's lives and impact people's lives and make a difference on a one-to-one relationship every day when you're working at a hospital and whatnot. But, I was lucky enough to meet some folks who know how to build software and design, and I realized I can push that to a much larger amount of people more effectively. And so for me, what gets me up is realizing hey, I have an awesome opportunity right in front of me where I can help so many people and make their lives so much healthier and happier and easier. And that to me is just, it makes me smile when I wake up in the morning, to be honest. It's very inspiring. It motivates me every day that I can have such a big impact on so many people.
Fun when the work that you do is also something that you love.
Yeah, definitely. For me, it doesn't really feel like work, to be honest. Like you're saying, I mean, it feels like I have a really big purpose, and
right.
That's really awesome to me, and it feels great.
I'm glad you brought that up. What was it that made you, and we'll talk a lot more about imaging and radiology, but I'm really curious, with RadButter, what was it that made you say, hey, I can help more people with this? What started that feeling?
Yeah, it's actually, it's crazy. So, I mean, in my personal life, I think a lot of us are always, impacted by those closest to us. There's the expression, you become, who you surround yourself with. And I think for me, it wasn't necessarily that I was, becoming who I was surrounding myself with. It's about the things that were going on in people that were close to me's lives. My parents started to get a lot of health issues as I got older myself. My dad got cancer at stage 3, breast cancer actually, which is very rare for a guy. My mom got, started to have insulin sensitivity and liver issues, diabetes related items. I hope they don't mind me talking about that. Um,
Sorry, mom.
and and then right, and then just a little bit later, one of my best friends and neighbors, who's actually also my co-founder, he got into a car accident, crazy car accident, and had to be rushed to the hospital and get X-rays, CTs, MRIs, and at the same time, my partner, she also found herself needing ultrasound. And so what I realized basically was this: is that all these people needed healthcare, right? And the first step in healthcare and whatnot of finding the root cause for stuff is, okay, now, all these people close to me, need access to these things that I know a great amount of, a great amount of information and knowledge about. And I'm like, oh, wow, these people that I really love, they don't have any information. They don't have any resources. They don't have access to pricing. They don't have any of this available to them. And I was like, I know about all of this. I could help these people. And if I can help these people, what can I do to help these people, not just these people that I love that are close to me, but everybody? What can I do to help the United States population, people of every background, every community? I mean, some of these people who I'm mentioning who are close to me may have really good access to healthcare and some very little, or don't know much about it. My co-founder, he's actually not even from the United States. He's from a country where healthcare is free. And so for him, it was a huge surprise to walk into a hospital and, hey, what's going on? Like now,
Right.
I don't know how much I'm getting charged for anything. I don't know anything about radiology, how to find out what's going on, with my neck, back, brain after this car accident. It was all these things, a culmination. And I said, wow, there's an opportunity here with RadButter where I can create a platform, a resource for people to find access to all this information and to actually not just find access to the information, but streamline the entire process. I mean, is that something you'd want me to speak more about, or is it, just more mainly the inspiration that you're curious to hear about?
Yeah, yeah. So, and we'll definitely get more into the details of Rad Butter, but I really wanted to
Mhm.
know, and you told me that story too, but I really wanted the people to know like where this was coming from. And
Yeah.
you brought up something when you were telling that story about access for everyone. And after having a conversation with you and talk and understanding how, imaging and getting these services, the access may not be for everybody, and it may be harder for everyone to get to. So in radiology, how would you define equitable access?
It's a great question, right? And I think it just comes down to the word equitable, right? Equal access. It doesn't matter where you're from. It doesn't matter who you are. I think when you look at equitable access, that could mean accessibility. When we're talking about accessibility, we're talking about how easy is it for this individual to get access to this exam, right? What are the steps that they have to go through? And that could mean different things for different people. So you could live in a rural area. You could have poor access to transportation. You could live in a city that has fewer facilities based on the socioeconomic factors of that neighborhood or whatever the case may be. There's a lot of different things that come into place, but you're really just looking at people of all different backgrounds and saying, how easy is it for people from every different background to get access to getting this exam, and not just getting access to the exam, but getting access to it in the right time frame? Meaning, if you have a disease or a pathology, uh, those extra few days, weeks, whatever that may be, may mean the world to them to getting healthier and being able to treat that properly and effectively. So when I look at equitable access, that's what I'm talking about, I think. And that's what I think it means, is just reducing the barriers really for people, no matter who it is. Transportation is actually the one that comes up the most, and location or geography, surprisingly. And that doesn't just mean in the United States, but it could mean in the world.
And that kind of leads to my next question. You just kind of touched on it. Some of the challenges uh, in radiology. What are some of the challenges that you see? And it sounds like travel or getting transportation is one of them. But you also touched on maybe the community that they are in. What kind of, are there? And you've worked in the field. Can you kind of talk about some differences that you've seen, or some things you've seen where getting access to imaging has been difficult for people?
So the first that comes to mind is I was actually doing some work helping out facilities in New York City during the COVID pandemic.
Right. Okay.
Heart of the pandemic, heart of the whole thing, New York City,
Ew.
right?
Mm-hmm.
And, the one thing that really stuck out to me and was very hard to see, uh, it was that, you would go into neighborhoods that were more affluent to work at a facility there and everything's up and running. There were, there was more financial, there was more monetary resources allocated to those neighborhoods to make sure that those radiology facilities were actually open and remained open and were functional. And then in areas maybe further out in the boroughs that had a lower amount of money or wealth in those neighborhoods, whether it was Queens or Brooklyn, Ridgewood, far out into those neighborhoods that are further away from the city where it's very expensive to live, those facilities were just shut down. And when it comes to radiology, some people say that it's elective, but it doesn't necessarily mean that it is elective. And when we say elective, just so I'm clear, elective is the same way you could say plastic surgery would be elective. I would say, is it necessary? That's the right word. When you talk about radiology being elective, it isn't really necessarily an elective thing unless
It
it's
throws me off when you say
uh,
that. Yeah.
yeah, it's not necessarily elective, right? If someone has really bad headaches and they're okay right now at the current moment, that doesn't mean that it's still elective. They could have something serious, a tumor growing in their brain that's causing the headaches, which means that it's not elective. So when you look at how this was all treated and different neighborhoods being shut down, facilities in different neighborhoods being shut down, that was the biggest thing. I think another is, as I mentioned, transportation, access to transportation, and the elderly population. How are we taking care of, folks in those areas? And now in radiology, there's a lot of companies doing what's called on-site imaging or mobile X-ray and ultrasound. And what's awesome, and it's not just X-ray and ultrasound, but now MRI even, which is the most expensive of the type of exam, or as we call it, modality. There's new technology, emerging technologies that are coming out, and it's about giving people access to the information that these new technologies are coming to them. For example, in ultrasound, you can actually plug your phone into a ultrasound transducer and do a test inside someone's home now with an ultrasound, or
Oh,
what
wow.
used to be a non-mobile device. You now have something that's similar to that of a laptop that a radiologic technologist can actually go into a car, put that device in the car, and drive out to that. Maybe it's an elderly facility where those people can't get in the car and drive to a hospital or outpatient radiology facility. Maybe that's someone who fell, who's maybe your parent fell and broke their hip, or they think they have a broken hip, and it's like, okay, what do we do here? What's an adequate solution? You can have someone put a mobile X-ray device in their van, drive out there, shoot an X-ray, and you can then make a decision that saves quite a bit of money, and promotes value-based care, and also is better for the patient, easier for the patient, gives them more accessibility, and is also pretty cost effective. And now they can understand, here's the root cause. Is it a fracture? Is it a break? Or is it a bruise, right? Or is it, a severe bruise? And now even in MR, which is the last one that I can really talk about even more, is, and when I worked at, this is in reference to when I worked at the equipment manufacturing companies, they are coming out with MRI machines now that are half the price of what they used to be, and built so that you don't need to hook up certain technologies. You may just need access to electricity. MRI machines run on something called helium to cool them down. And you used to need to drive, in rural areas, it would be very expensive for the equipment manufacturer to drive very far out to fill these machines. And now you don't need that anymore. They recycle the helium inside the magnet. So this is kind of more physics and technical. But what I'm trying to say essentially is you can actually have a magnet that's serviceable from a remote computer or a remote location. So if it shuts down, it can be booted or fixed from a remote area. It can be installed and is cost effective to be installed in smaller locations, in more rural locations. They have technology that lets them run themselves, almost run themselves where you can now mitigate the issue of access to labor and technical expertise. So there's a lot of technologies coming out and a lot of resources that are becoming available, but it's about knowing that these resources exist and knowing how to deploy them that I think is the issue.
Right. Because I was just going to say, those all sound like great new technologies that can not only make healthcare more accessible to all people, but if you don't know that that's even available, or even know to even ask about those options to see maybe if you're where you can get that done at, it doesn't mean anything if you don't know.
Exactly.
Man, okay. So, why should people, pay more attention to the role radiology plays in healthcare disparities?
That's also another great question. And, as it pertains to radiology, it's so often overlooked, which is so difficult for me to see as someone who's specialized in that field. So, we often focus on the role of the primary care physician in healthcare. And that's because your primary care physician is, really the quarterback of a patient's healthcare. And so we have tools now like telehealth that lowers, the disparities and improves access to care, accessibility. You can just go on your computer. When we talk about this now, yes, it's great to see a primary care physician, and I wholly believe that it's very important as for them to be the quarterback of your healthcare. But what happens when the quarterback, and Corey, you'll like this because, we're both from alma maters that are big in football. What
Yeah.
happens when that quarterback needs to throw to their receiver or hand the ball off to their running back? That running back or wide receiver, or for anyone who's not a football fan, the first step in understanding what your symptoms are, what's causing your issues, is to do a root cause analysis, meaning, what is the root cause of your issues, your symptoms? What's causing your headaches? What's causing, your depression? What's causing X, Y, and Z? It doesn't matter what that might be. What is causing it? And the best way to find out the cause of what's going on inside your body is to look inside of it, and to say, this is what's going on. Okay. So an interesting statistic is 75% of patients that are admitted to the hospital are immediately sent to radiology departments for imaging to figure out what's going on. And that number is significant. And I think that it tells us something that, hey, we don't necessarily always have to go to the hospitals, because a lot of people don't realize your primary care, you can go to your primary care. It's not, unless of course it's an emergent situation. I don't think a lot of people realize, hey, if, your shoulder's bothering you because you went to the gym or whatever the case is, you can go to your doctor and maybe they will give you a script or an order for an X-ray, a CT, an MRI, whatever the case is. And now you can go to an outpatient facility and get that done and find out what's going on and figure out the best treatment, so you don't keep going to the gym and hurt your shoulder, or so you don't, keep engaging in the same behaviors that maybe is causing a symptom. And it's obviously not specific just to musculoskeletal acute issues, but can also be for chronic diseases, whether that's, monitoring multiple sclerosis, or monitoring if you have osteosarcoma or a bone infection caused by diabetes. There's a whole bunch of reasons why, you can use radiology to monitor chronic conditions in a very cost-effective manner. And that's why I think radiology is overlooked, is because it's really that foundational and pivotal cornerstone or keystone for knowing really what's going on in your body and what to do next. It's the first line of defense that you have to get around.
Yeah, and that's so true to me now. I was one of those people that I didn't even think of radiology having such a huge role, because you don't even get a referral for that unless it's something big, or it's always like you said, an elective. Well, what the fear is what if you are having that headache? The doctor's like, well, wait on it. Well, how long do you wait? And so if something is really truly happening, but not even having the information to know, well, hey, can I go to this private practice, or can I do this, or what the costs are? There are so many things around imaging that I'm currently starting to learn after having our conversation, and realizing, like, man, there is a big role here that I feel like the healthcare as a whole is overlooking when it comes to imaging services?
Yeah, I think that to touch even more on what I was saying a little bit, we look at something, like, hey, I'm having headaches. Do I need to go to the hospital? Well, no. And here's the thing is that really to relate this back to RadButter and what we're doing and why I wake up in the morning is, as of July 1st, 2022, CMS, which is insurance reimbursements, the Center for Medicare and Medicaid Services, that handle that whole component, they are enforcing now price transparency in the healthcare field. And I think this is finally the first step for healthcare to go in the right direction to make it accessible for people to not be confused and complicated, for patients to have a better understanding of what's going on. And what we're doing is we're essentially opening that up in a way where you can have menu style pricing. It's a true marketplace platform, as if you were going on Yelp or OpenTable or Amazon, where you can see every healthcare facility that does radiology, and you can see what their prices are, what their available appointments are. And so if you go to the doctor and you're coming in and you're saying, I have this issue and I just want to get better, and maybe, the doctor wants to send you, your physician wants to send you, one way or do something else. I mean, yeah, you can really take control of that now and say, hey, I would really like to get an X-ray, MRI, CT, whatever the case is, and really have that conversation with them and get an order or a script for that, and simply find and book the lowest cost, highest value, highest quality, based on ratings and reviews, based on the soonest available time slots, and reduce that cost really by more than a quarter, reduce that time to diagnosis by more than a quarter, because, just like anything, healthcare isn't perfect, science isn't even perfect, but it's giving you the option to take control of your own healthcare journey and say, okay, now I can find out for myself what's going on. And it kind of levels the playing field, because before, I think a lot of people didn't know that they could ask. They didn't know that they could go to their primary care and say, hey, can I get this done? I'm concerned. It's my body, right? I want to know what's going on. I want to get an answer right away. And maybe insurance will cover it, maybe not. But now you have the access to see cash prices. You have the access to see if your insurance will cover it and how much that will cost based on your plan. And now it kind of just opens up a whole world, where you have a marketplace to look. And that's just something to me that's amazing. I think it just gives people an amazing opportunity to take control of their healthcare journey, no matter what background they're in, because the prices are a lot different now when you can see them versus when you can't. So it's very exciting.
So not only can you go to your provider and say, hey, I would like to get this imaging service done, but you can also tell them where you want to go based off of, for one, what you see from the app, price, and then what you're comfortable with.
Yeah, and to clarify, you do need to have legitimate clinical reasons or indications that would, allow someone to, make that script or order for you to go in, of course. But nonetheless, it's an opportunity to say, hey, there really is a way now for me to simply shop for my healthcare, to find the, just like if you were to buy a phone, if you were to buy something at the grocery store, you can see your options based on the type of exam and the soonest available appointment. And, if you're someone that wants to be healthy, to prevent, and I think prevention is a big thing, to prevent something from getting worse or prevent something that is just starting. This is it's an amazing opportunity now for people to have a level playing field. It's no longer just limited to a high tax bracket or a high earning individual who has some type of concierge medicine. It's now accessible to anyone of any background. It's simply anyone who has access to the internet can go online and see this stuff. And that's to me what, like I said, what's amazing.
That's awesome. Well, Elan, thank you so much for being on the podcast with me today, man. I really appreciated the information. For anyone listening that wants to learn more about you, RadButter, and the things you guys are doing, where can they find you?
Yeah, so starting tomorrow, or by the time this is posted, you can go to radbutter.com to find information on anything regarding radiology, what to expect during radiology exams, the top radiology facilities in your area, ratings, reviews, etc., soonest appointments, all that stuff that was kind of mentioned briefly. But in addition to that, you can find me on Twitter at rad_butter_ or Elan _ here.
All right.
You can also, yeah, so those are the main places. I'm also on LinkedIn, and you can just search my name, Elan Adler. So I'm on there, discussing about patient advocacy, radiology, and equitable access to care in radiology quite a bit. But thank you, Corey, for having me on the podcast. It was a pleasure to talk to you and get to discuss this and share with your listeners about radiology in the healthcare world.
Absolutely, man. Thank you for reaching out. I learned something new today, so I really appreciated everything. Again, thank you for being on, and everyone, thank you for listening to the Healthy Project podcast. I'll holler at you next time.